Diabetes mellitus can be due to primarily problems with insulin. And so there's two different types. The first one is type 1, and it's due to hyposecretion of the insulin. It's usually in patients that are younger, patients that are thin, and this is treated with insulin injections. The second type is type 2, also some people say adult onset diabetes. It's hypoactivity of the insulin, and there's risk factors that can cause it to develop. So being overweight is a factor that can increase the chances of type 2 diabetes. And in this case, what happens is the beta cells do not produce enough insulin. They produce inadequate quantities of insulin. Now, the three main cardinal signs of diabetes mellitus, the three main symptoms, the first one is polyuria, and polyuria has to do with huge urine output. And in this case, the glucose acts as an osmotic diuretic. And there's also polydipsia. This is referred to, this is excessive thirst due to water loss due to the polyuria. So they kind of go hand in hand. And then the polyphagia has to do with excessive hunger and food consumption. It's almost like the cells can't take up enough glucose, so they're starving. And when the sugars can't be used, the fats are used, but this causes lipidemia, which is high levels of fatty acid in the blood, and that's a risk factor then for cardiovascular problems. So when fatty acids are metabolized, the resulting chemical that's formed are called ketones. Ketones produce a fruity smell that these patients will exhibit. Hyperinsulinism is excessive insulin secretion, and because of this, there is hypoglycemia that occurs. Because remember, insulin is a hypoglycemic agent. Now, don't get diabetes mellitus confused with diabetes insipidus. Diabetes insipidus is dilute urine and is due to hyposecretion of ADH. So the hormone that's stored in the posterior pituitary gland and produced in the hypothalamus. So this slide shows us the consequences of insulin deficiency, diabetes mellitus. And so we can see, first of all, we can see the decrease in insulin, and this is going to, in turn, it's going to cause the liver to break down glycogen to glucose so that there's more glucose available. Skeletal muscle stores are also going to be empty. They store glucose, so that will be emptied to go into the blood. So that would lead to hyperglycemia. And then the result is there's so much extra glucose in the blood that a lot of it spills out into the urine at the kidneys. So that's the polyuria, one of the symptoms of diabetes. And that's then going to lead to dehydration. The patient's losing a lot of extra water. So because of that, they're extra thirsty, and that's called polydipsia. Now also, the lack of insulin is going to affect the fat cells. So that causes the fats to be broken down into something usable, and that's called lipolysis. The liver then converts the fat to ketone bodies. But unfortunately, since this is acidic, it lowers the blood pH, causing another problem. And people can have an acetone breath, which is a fruity smell on their breath. But because of the problems with these electrolytes, as you can imagine, many of these problems can also occur. Problems to the heart, nausea, vomiting, central nervous system problems. And this then also leads to polyphagia, which is the increase in appetite. So the next endocrine organ we're going to look at is the gonads. And the gonads produce the same sex hormones as those of the adrenal cortex, just lesser amounts. And that would, remember, in the adrenal cortex, that's the innermost layer of the adrenal cortex. The gonads, they produce estrogens and progesterone, the ovaries do, and the testes produce testosterone. Now, testosterone is going to be secreted from the testes based on the production of LH from the anterior pituitary gland, and sperm production occurs in the seminiferous tubules, and it occurs because of FSH released from the anterior pituitary gland. The next endocrine tissue is the placenta. The placenta secretes estrogens, progesterone, and human chorionic gonadotropin. So as the embryo is developing into the fetus, the placenta is the temporary endocrine organ that's present. So there's also other tissues throughout the body that aren't endocrine organs, but some of the tissue produces different hormones. So one example is in adipose tissue, there's a hormone called leptin, which stimulates increased energy expenditure, and it's also for appetite control. Other examples of parts of the body that are not endocrine tissues, but they have cells that are endocrine in function, are shown here. So the gastrointestinal tract has several of them, and there are specialized cells lining the GI tract called enteroendocrine cells. These hormones include things like gastrin, and that stimulates the release of hydrochloric acid in the stomach. Secretin stimulates the liver and the pancreas. CCK stands for cholecystokinin. It activates the pancreas, the gallbladder, and the hepatopancreatic sphincter. And these two are going to be released based on the types of chemicals that are in the small intestine at the time. The next tissue that produces some hormones is ANP, atrial natriuretic peptide, and it decreases blood calcium. So this is the antagonistic hormone to aldosterone. Remember, aldosterone causes sodium reabsorption in the kidney tubules. And then in the kidneys, there is a hormone, erythropoietin, signals the production of red blood cells, and it stimulates the bone marrow to start producing red blood cells. Renin initiates the renin-angiotensin-aldosterone system. This is mainly a system that increases blood pressure through several different means. In addition, the skeleton also releases some hormones, the skin and the thymus. The skeleton has osteoblasts. These are the cells that are going to be building new bone cells, secretes osteocalcin. In the skin, there's a couple different hormones. Cholecalciferol, that's the precursor of vitamin D, and then calcitriol, that's the active form of vitamin D. And vitamin D is necessary to absorb calcium in the GI tract. And then finally, the thymus is very important for causing development of the T lymphocytes in the immune response. And it's large in infants and children, and it starts to shrink about age 13 to 15, somewhere in there. And one of the hormones produced is called the thymosin, which is going to trigger the development of the T lymphocytes.